The global campaign against the deadly Ebola virus is reported yielding positive results. Based on latest figures released by the World Health Organization, there has been a significant decline in Ebola cases. Meanwhile, the Philippines has added $2 million to the dwindling global funds in the campaign against the Ebola menace. This report.
The United Nations and World Health Organization thanked the Philippine government after it handed over a $2 million donation to the UN Multi-Partner Trust Fund for the Ebola response. According to UN Special Envoy on Ebola, Dr. David Navarro, the Philippine government's came in very timely, as the $138 million donation from all the 40 countries and private sectors, which was provided to address the situation in the 3 Ebola-stricken countries, was now getting fewer.
I'm so pleased to have had this opportunity to work with you all and to do this in conjunction with Dr. Hall, a colleague with whom I've worked in the past on similar issues. It's really great that on behalf of the people of the Philippines and the nation, you are expressing such a lot of interest in these issues. Therefore, through you, once again, to thank the government and the people of your country for the solidarity that you have shown with the people of the world who are struggling to deal with the Ebola outbreak, and who then will be recovering and redeveloping their health systems and their nations.
The donation to their efforts for Ebola will also help as well, as Dr. Navarro has said, to get us to zero, to remove those risks globally in the affected countries, but also to the Philippines.
Data from the World Health Organization show that campaign against Ebola has been doing great. From 800 cases recorded by WHO per week, it was now down to 80 cases. The UN and WHO also recognized the measures taken by the Philippine government to prevent the spread of Ebola.
There has been no individual coming into your country who has been confirmed to have Ebola infection. So in summary, therefore, the government has acted in an effective way. There has been no effect on people in your country. There has been no danger for people. And there is, as I understand it, continued efforts to make certain, as Dr. Hall said, that the situation is kept under regular review.
That training on Ebola had an extra benefit. It was the Ebola-trained doctors and nurses that thought perhaps this nurse has something unusual. And that diagnosis of MERS was made very quickly, and that was controlled and contained quickly. So in some ways that was a good practice of the system here, and showed that the investments the government have made a big difference, not just for Ebola preparedness, but preparedness for other diseases as well.
25,000 cases of Ebola were logged in Sierra Leone, Guinea, and Liberia. Of this number, 10,000 had died. There are also 4 other countries which have a small number of Ebola cases. The United Nations noted that even the Philippines has experienced devastation from Super Typhoon Yolanda, the country did not forget to extend a hand to those suffering from Ebola in West Africa.